Hi everyone, my name is Maggie, and I am going to be diving right into the question of what makes a good interprofessional service member for public health. So, the public health field itself is a very broad field. There are many different career paths that one could take with a public health degree. We all know this. Some career paths that you can take include epidemiology, microbiology, dietitian or nutritionist, health educators and community health workers, doctors, nurses, etc., etc. Any of these career paths require interprofessional service and interprofessional collaboration. What is interprofessional collaboration exactly? I found a definition that says it is when multiple health workers from different professional backgrounds work together with patients, families, caregivers, community members, family members of patients, I think I mentioned that, to deliver the highest quality of care to patients and to patients' family members. Now, interprofessional collaboration is an important aspect of any career, I think. Any job in any field requires collaboration between those with different backgrounds. Any skill sets are necessary, and a variety of skill sets are necessary within any career field, not just public health. If you think about it, most jobs don't have one person doing one type of job every day. Even if that is the case and a certain company only has one employee and that employee only does one thing every day, that person has to collaborate with outside vendors or customers or anyone else to collaborate to make a business work. The same applies for public health. One would need to work with people outside of their knowledge and skill set to provide care for the public, the community, patients, etc., to provide quality care to those in need. If you think about it, hospitals don't have one type of worker with one type of skill set either. They have doctors, nurses, technicians, EMTs, those who work with the technology in the hospitals. They all collaborate and work together to make a hospital run smoothly and to provide care for the patients in the hospital that they see on a daily basis. Now, what makes a good interprofessional service member specifically for public health? I believe it's someone who can work well as a team. Obviously, if you're collaborating and if you're working towards a common goal of helping the community or helping patients, teamwork is highly important. You have to trust one another and trust one another's decisions. Using different skill sets of different members of your team are important, so you have to trust those team members to use their skills as they know. Otherwise, a plan could crumble. A good interprofessional service member has confidence in what they do. Not only do you need to trust your other team members, but you have to trust yourself in your decisions and what you know and what you can apply to help your team grow. You need to respect one another and respect their decisions. And there is leadership involved in these interprofessional collaborations. Sometimes other members have to make decisions that you might not agree with, but working together and trusting one another and respecting one another and following leadership or giving your own leadership can make a team work very well together. Interprofessional collaboration in healthcare helps prevent medication errors. It improves the patient experience and delivers better patient outcomes, which in turn can reduce healthcare costs, which is always a plus. Working across all public health professions and health professions in general will improve overall population health, as we will see. Public health plays significant roles in other career fields as well, not just within public health or within the healthcare field. Public health plays a significant role in law, engineering, urban planning, social sciences, or a lot of other fields that many may not even realize. And working together with other health professionals, public health leaders can learn about the needs of the population and the best practices to meet those needs as well. Now, the service that I had been participating in, I volunteered at the local Boys and Girls Club in my area. So I was not able to be a mentor, but I got to interact with the youth of the program, ages 6 to 20. I was able to work with the employees and the other volunteers at the club, and we really did collaborate together well. Personal goals of mine were just to connect with the youth there, give my leadership as much as I could, and my mentorship just be someone that they could talk to, which otherwise many of these kids don't have an outlet like they could at home, so they go to the Boys and Girls Club to get sometimes meals. They learn life skills like defense classes or other reading and writing that they might not get at school. And we did a lot of like recreational activities that keeps them out of bad habits and other bad activities. So learning from the employees and the other volunteers at the program was inspiring for someone interested in public health. Collaborating together and caring about the public was a huge part of what makes a good interprofessional service member in public health, especially at this program. The employees definitely had a passion for what they do, and that was really important. That's about it. Thank you.